Hi, I'm Dr. Todd Mexico, and I want to talk to you today about a question that I receive all the time in my office, and that is, can sitting on a wallet cause sciatica? This is a question that I field so often, I figured I'd just make a quick video. That way I can help others that may have the same question. So the question usually goes something like this. Dr. Mexico, my husband is complaining of lower back pain with symptoms also traveling down the back of the leg, kind of in his buttock. He says that it feels like he's sitting on a golf ball sometimes. Is this sciatica? I've heard that sitting on a wallet can cause this. Is this true? So sounds very much something like that, and I hear it all the time. It's usually a wife asking for her husband. It's a great question, and the short answer to this question is a resounding yes. Sitting on a wallet without question or dispute can lead to symptoms of sciatica and lower back pain. The more important question that we should be asking is something else causing your husband's lower back and leg symptoms? So allow me to elaborate on that, and then we'll talk about sciatica and wallet sciatica. So the sciatic nerve is the largest nerve per diameter in the human body. It's really made up of several nerve roots that start in the lumbar spine in the lower back that join together to form a very large nerve, about the size of my pinky or even larger in some people, in an area of the pocket, your buttock, in the pocket. So think of these other nerves coming from your lower back as kind of like side roads or roots that are leading to an interstate, and the interstate is the sciatic nerve. The sciatic nerve is formed right around again, that area that's right in your pocket where most men will put their wallet. So if you're sitting down right now watching this video, what I'd like you to do is pause the video for a second and then go and grab something like 1 to 2 inches thick and sit on it. Just place it right under your butt, right where your pocket would be, and leave it there, leave the object there for the remainder of this video. So the object, this object that you just placed under your buttock, it's equivalent to about the size of most men's wallet, between 1 to 2 inches thick. So, and that presses firmly against the sciatic nerve. So try to imagine, sitting on that all day long or for your daily commute. It is quite literally a pain in the butt. This constant pressure on the sciatic nerve can cause the surrounding muscles, namely a muscle called the piriformis muscle, to go into spasm, which leads to a condition that is called Piriformis syndrome, or also known as wallet sciatica. The piriformis muscle lies right above where the sciatic nerve exits, and when this muscle is tight, it literally squeezes on the sciatic nerve. This pressure on the sciatic nerve can lead to pain, numbness, and tingling in the buttock all the way down the back of the leg. So it's important to realize that most of the time pain from sciatica does not travel really much lower than the back of the knee, but occasionally it can be experienced in the foot as well. Typically people will complain of pain kind of like right in the buttock that goes on the back of their hamstring. So sitting on that wallet also unlevels your pelvis. And this puts undue stress on your lower back, which can lead to lower back pain. So think of this as like, putting a shim or a block under one of the legs of a coffee table that is already on a level surface. This would take, the table and put it out of balance. That's what it does to your pelvis, and then it causes discomfort in the back. This can affect the function of the sacroiliac joint as well as the lumbar spine, leading to pain as well as sciatica. So most men, unfortunately, that sit on their wallet all day don't even feel the wallet under their buttocks. This is because the body goes through a process called adaptation. So adaptation occurs when an object is in place for a long time. It's your body's way of telling you to ignore it so that you don't constantly feel like there's something there. So some pretty good examples of adaptation are, those of you that wear eyeglasses or, wedding rings and wristwatch. So unless you think about these objects, my wedding ring or my wristwatch, unless you think about it, you don't even realize that they're there because you've been wearing them for so long, your body is trained to ignore them. you imagine how annoying it would be if I felt this wristwatch or my ring on my finger all day? So your body's also trained to realize that your wallet has been there for so long, so it tells you to ignore it. This is not good for your lower back, your hips, or your sciatic nerve, because you're constantly applying pressure to the nerve that you don't even feel. So again, as I mentioned before, the more important question is something else causing the symptoms or the sciatic symptoms for your husband or for yourself? This is because all of the symptoms that I've mentioned may also be due to a more serious condition, such as a herniated disc or a mass in your spine, and only a qualified medical doctor, chiropractic physician, or physical therapist can tell you whether the wallet is causing your symptoms or perhaps it's something more serious. So yes, wallets can cause sciatica. Yes, that could be the problem, but it could also be something else. So see a physician and get checked out. I hope this information helped you. Thank you for watching it. And as always, please comment in the section below where you're watching from. And if you liked the video, please give it a share. As always, thank you so much for watching. This is Dr. Todd Mexico, and make it a great day.